Dr. Kohli joins us live to discuss weight. I'm so glad that we have a medical professional to talk about this. So, Dr. Kohli.
I feel like that was a shot at me.
Well, you claim to be a medical professional, but you're not.
Dr. Dre is a doctor, and he's at the Super Bowl this weekend.
Yeah, but Dr. Dre is like a doctor at Beats.
And
you
the
could
Super
be a
Bowl
doctor
is
at
next
talking.
weekend.
Okay, there we go.
Dr. Kohli, I apologize. Welcome to the show. At what point does weight affect your health?
You know, we really have to start thinking about excess weight like a medical condition rather than a judgment. So let me give you an example. If I told Jeff, you have high cholesterol, or I told Al, you have high blood pressure, would I be cholesterol shaming them or would I be blood pressure shaming them? No, because we think of this like a medical condition. And excess weight, guys, is a serious medical condition. It can cause high blood pressure, it can cause strokes, it can cause heart attacks. In my office, I would say 9 out of 10 of my patients, I tell them, you got to lose that weight. You got to lose your tummy because you're going to have a heart attack or stroke if you don't. And they don't react to it in a bad way because it's coming in a context where it's taken as a medical advice rather than a reflection on their physical appearance. It's a reflection on their health.
All right, Doc,
Great.
well, we got to switch gears because you know we got to talk a little COVID, but this is semi-good news. Now, it seems like COVID cases are falling, at least a little bit. And this has a lot of people wondering, can we stop wearing masks? What would you say to them?
I think that's coming on the horizon, but I think doing that today is a little bit premature. So it's sort of like saying, oh, the cancer is responding to the chemotherapy, so let's stop giving chemotherapy before the entire cancer is gone. Or if you prefer wartime analogy, you're in battle, you're winning, you got the upper hand, and then all of a sudden you say, okay, let me throw down my weapons and retreat because I got this in the bag. So right now, cases are not where they need to be. Al, we need to have that positivity rate less than 5%. We need to have it stay less than 5% for at least a couple of weeks, suggesting to us that things have stabilized. And we need to make sure that there's not a new variant cooking out there because this virus has been one step ahead of us in the entire last battle that we've been fighting for the last 2 years.
All right.
Well, Dr. Kohli, the pandemic has taken a toll on really everything, but on Americans' hearts as well. So even those who haven't had COVID. So according to a Cleveland Clinic survey,
Oh my gosh.
41% say that they experienced at least one cardiac-related issue since March of 2020. So Dr. Kohli, what kind of heart issues are people dealing with right now?
So February is Heart Health Month, so it's a good time to talk about heart issues. And of course, we're dealing with heartbreak and all of that stuff as well, but we're also dealing with physical heart issues. So the biggest piece of this, of course, is that, COVID can directly affect the heart. But you know what I saw as a cardiologist was that people were in the midst of their heart attacks, they were in the midst of their strokes, and they were afraid to go to the hospital.
Wow.
Or they put off going to the hospital because they had fear. And you took a tiny heart attack and turned it into a chronic heart problem. What we also saw, of course, was people using more substances, drinking more, smoking more, being more sedentary, gaining weight, as we've talked about, not controlling blood pressure, all of these things that are essentially going to manifest themselves. So guys, medical professionals are worried about the next curve of the pandemic. And it's not the people that are going to get COVID-19, but it's the people that are going to develop heart disease. And that's going to happen over the next several years or months. And we need to start flattening that today.
Great advice as always, Dr. Kohli. We do have a viewer question from Monique, and she asks, I'm thinking about having people over to watch the big game. What are things I should think about before making my final decision? I think a lot of Americans, this is running through their mind right now as well.
Well, with respect to COVID, I think it's really important to make sure everybody coming to your party, Monique, is vaccinated and boosted, ideally boosted within the last 10 weeks. I would also recommend, however, if they're outside your immediate bubble, that you use rapid tests and use them at least a day before and then the day of again to make sure that everyone's clear. And then with respect to your heart health, make sure you've got heart healthy snacks like fruits and vegetables. None of those potato chips or Cheetos or those types.
And a beer is good for your heart, right? One beer?
I think it was red wine, but I'll give you a beer for
All right,
the
a
Super
chicken
Bowl.
wing
How
and a
about
beer,
that?
it's good for you.
When is the big game? When is it?
The
What?
13th.
What do you mean?
Yeah, Al was confused too because he said
I
this
said next
weekend.
week.
Okay. All right. A couple weeks from now. Thank you, Dr. Kohli, as always. If you have a question you want answered by Dr. Kohli, write us on social media. You can also email us at info@dailyblastlive.com. Thank you, Dr. Kohli.